Okay, excellent. If you guys want to come in and sit down, we're getting ready to start the next one. So I want to encourage you guys to ask questions because, that the more you're involved, the more you're going to know and remember this stuff. When I was in medical school, they told me that learning was remembering because we were really worried about the amount of information that we were going to have to consume and remember. And so the biggest problem was we all thought, oh, well, they're going to give us this once, and we're never going to hear it again. And the instructors assured us that you will hear this so many times that you'll get sick of hearing it. Okay, and so they went over and over and over. So I want to encourage you to make sure that if you don't have pictures of these books, or that if this is something that you're really interested in, we want you to take pictures of these books and acquire them so that you have references. Einstein said you don't have to remember anything that you can look up, but you have to know where to look it up.
Remember, we have nothing to fear unless we forget.
That's right. That's right. So, yeah, I have a fear of forgetting. So it's a learning process to go through this so that we understand what we can use in an emergency. And so that's what I want to talk about now is what do we do in an emergency? And the way that this came about was my kids were kind of all grown. And like I said in the last lecture, they were kind of my guinea pigs growing. As they were growing up, we'd say, okay, take this and take that. And for instance, my youngest son, he was in public school, and he developed tonsillitis. And if we would have taken him to the medical doctor, what would they have done? They just pulled them things out, And so, but we didn't want to do that. As much as the scientific world would like to think that we have vestigial organs, those things that they're not good for anything. Tonsils are part of the first line of immune system. And so, but he got tonsillitis. And so I'm giving him golden seal, I'm giving him echinacea, I'm giving him oil of oregano, I'm giving him all of these things, and he is just not getting better. And I'm going, okay, gargle with salt, gargle with colloidal silver, all these things, and we couldn't get him to where he was getting better. And we knew that, we only have a certain window before the public school is going to say, hey, you need to take him to a real doctor. and so he was about a week into having this tonsillitis, and nothing seemed to be working. And I called my partner, and she's a master herbalist, and she goes, well, did you try that? And I said, yep, I tried that. Did you try this? Well, yeah, did that. Did you do that? Yeah, did that. And I make my own Lugol solution, which is an iodine preparation, okay? And prior to antibiotics and like that, they used it for scrubbing people or, cleaning wounds. When we go camping, we use it to purify water. So he was about 15 at the time, and I go, come here. And I dipped a cotton ball, put it on a big, long hemostat, and I grabbed him by the back of the neck. I knew what was going to happen. He didn't, okay? And so I got him like this, and I said, open your mouth. And I put that cotton ball with iodine back to the back of his throat, clear to the touch of the back of the throat. We didn't just stop at the tonsils. I went like this, and I went, and for about 15 minutes, he spit and sputtered and coughed and hacked and all of that. Well, the next day, he was 50% better. We'd been working on this for a week. And so I said, he by the time he regained his composure, he says, you will never do that to me again. Well, by the morning, he was 50% better. And I'm going, we need to do that again. And he's going, no. It took me probably an hour and a half to convince him that we need to do that again. Only this time, it wasn't so aggressive, maybe a little less iodine, a little less force, didn't grab him by the back of the neck, And so we got in there and kind of painted his tonsils and like that. By morning, he was good. Okay, so 2 days. But we had to use something that was right for the situation. What brought about these emergency herbal kits is that I have a daughter, and she was living in Florida at the time. I'm living in Washington, in Spokane. She calls me up. It's probably 10 o'clock my time, which makes it about 1 o'clock in the morning for her, okay? And she's going, Dad, I got this horrible cold, or I'm not feeling well. What can I do? And I said, okay, well, do you have some of this? No, I don't have any of that. I'm going, well, how about this? Do you have any of this? No, I don't have any of that either. I'm going, okay, well, what about this? This is going to be in most people's houses. No, I don't have any of that. It's too late to go to the pharmacy or anything like that. And so, so one of the things that I did was I put together a package for her so that and I sent it to her, so the next time she calls me up, she's got everything that's in this herbal pack. And this herbal pack allows her to do most of the emergency stuff. And so that's really important for my family, but I found that lots of people go, what do I do if in an emergency when I get sick or I have an accident or something like that? How do I navigate through that? So we carry these underneath our seats in the car so that if we're traveling or something like that, we always have these things. And so it's real. Now this isn't everything. Believe me, you could have a whole pharmacy in the back of your, and pharmacy is spelled F-A-R-M, right? Okay, but you could have a whole pharmacy in the back. Now, again, education is key. You need to have some understanding of these things and what they will do so that you can apply them correctly as you go. But with these emergency kits, one of the things that I have done is I've put 7 plus some more herbs on a laminated sheet, and this allows you to kind of go through what these will do, and we keep it with that so that you can start going through it. So let's start going through this emergency herbal kit.
Question.
Yep. Question. Wait for the mic. They want to get you on the mic. So most of these are going to be tinctures, or they're going to be things like charcoal. And so other than probably this one, it's white willow. This is a cut herb. The rest of it will last for a very long time. Okay, so our first one is cayenne powder. Okay, now cayenne powder is absolutely a miracle-working herb. I told the last group that I was in tile prior to becoming a doctor. And so I'm down on my knees. I'm probably my 7th trimester into chiropractic school, and I'm needing to make some money. I'm down on my knees trying to change this lady's linoleum in her kitchen. And so there's a piece of baseboard that is stuck between the tack strip of the carpet in the next room and the wall. And so I'm pulling on this thing, and so I have a knife in this hand trying to cut that thing out and like that. So I'm pulling on it, and I have that knife, and I go, and I stick myself in the wrist. Now, my instinct was, number one, to apply pressure, right? I wanted to stop the bleeding because it wasn't an artery, but it was oozing with a pulse. It wasn't spurting, so I hadn't gone deep enough to get an artery, but I'd hit a pretty good vein right there. And so I got up off the floor and I said, ma'am, do you have any cayenne pepper? And she says, what do you want cayenne pepper for? I says, cayenne pepper will swell the tissue and stop the bleeding. And so she goes, well, won't that sting? And I said, it already stings. And so she said, yeah, I've got some cayenne pepper and an herb and like that. And I said, well, let me have some. I sprinkled it on there and then applied pressure. Within seconds, it stopped the bleeding. I mean, it was just seconds, not minutes. I mean, I had this thing, and it was, like I said, it was oozing with a pulse. It was definitely, I'd hit a good vein, but within seconds. Now we've done this with lots of different types of bleeders, okay? And it not only works outside, but it also works inside. So if you have a diverticula or something like that is bleeding, it will stop the bleeding, okay? And so we love cayenne pepper. Another thing that cayenne pepper will do is one day I was out with an older lady, and it was in the middle of the winter. It was probably about, 15 degrees outside or something like that, and we're trying to fill her porch with firewood, okay? And so I'm chucking firewood up on the porch from the pickup truck, and she's out there helping me, and we get inside, and she says, my hands are just freezing. I think I might have frostbite, and like that. And I looked at her hands. Her hands were a little pale, but they weren't looking like the frostbite and like that. And I said, hold out your hands, because she had cayenne pepper in a salt shaker on her table. And I just salted her hands, and she rubbed them together, and instantly her hands were warm, because it draws that blood right to the area. And so it was very handy for her to increase her circulation just by putting some cayenne pepper on her hands. It will also reduce blood pressure. So the funny thing is about cayenne is it will swell tissue around a bleeder, but it'll vasodilate an artery or a vein. And so it'll make those arteries or veins bigger to allow for blood to go through more freely. And so it'll lower that blood pressure.
How much do you take for that?
To lower your blood pressure, well, number one, it has to be consistent. You don't want to be taking it, one day and not taking it the next, or take it for 2 weeks and then stop. It needs to be consistent. And so I would recommend, especially in the very beginning, I would take a good, like a 90,000 IE, international heat unit, but I would take it probably 2 to 3 capsules 3 times a day. And that needs to be consistent. I mean, and you got to realize that it is not a absolute fix. What the cayenne pepper is, it's momentarily vasodilating. And so if you stop using it, the veins will constrict again just like they were before. So this is not a fix, but it will lower blood pressure, okay? Also, it's great for pain relief. How many of you ever heard of capsaicin cream? When I was in clinic, one of the things that I had this sweet little old lady, and she would come in and she said, "Oh, doc, my knees really hurt. Can you rub them?" And so I would take Christopher's cayenne capsaicin cream or salve, and I would rub her knees, and she would get instant relief. That heat, it's called a counter irritant, but it really helped her with the arthritis pain that she was having in her knees. And so absolutely love cayenne. One of the places that we use it, and we don't typically use the powder for it, we'll use cayenne in a tincture. Let's see, cayenne, locally used. Yeah, so we use cayenne in a tincture. Now, if a person is having a heart attack, one of the things that's going on is they're having an inflammation attack. They may have some plaquing inside that artery or something like that, but they'll have an inflammation, and that momentarily inflammation will cause other debris and like that to constrict that artery, okay? And so, again, we're looking for vasodilation. We're looking to open that artery up so that the person will get past that. Now, again, it's not curative. We're not trying to reverse the plaquing in their arteries. We're trying to save their life, okay? And so if a person is having a heart attack, especially if they're semi-conscious, what you want to do is you want to put cayenne tincture into their mouth and tip their head forward, okay? You never want to put a liquid in somebody's mouth and tip their head back because they can aspirate that. And the last thing you want is cayenne pepper in your lungs. That would not be a good thing. So what you do is they're having a heart attack, they're having some chest pains, they may be having some pain down their left arm. The unfortunate part for you women is many times your first heart attack is going to be symptomless. And that's a problem. But if you have any of the symptoms of a heart attack, simply tip their head forward and put a dropper full in their mouth. It'll be absorbed sublingually, and it will cause the heart to have vasodilation, okay? So if a person's having a heart attack, that's a great starting remedy. Now, you obviously want to call 911 and get them to a hospital so that they can be taken care of for that emergency situation, but you may have just saved their life simply because you put cayenne pepper in their mouth and tipped their head forward and allowed for vasodilation. Question?
How many heat units do you put in there?
Well,
Or is in your bottle?
So these, at that point, we're not really interested in how many heat units. This is 90,000 heat units. Let me see if it's written on my bottle here.
This would be just
90,000. So these are
okay.
90,000. I did the same lecture in Hayden, Idaho, and this young kid came up. He might have been 18, might have been 19, and he goes, "I got to try that." And I'm going, "Okay." And I asked him, "Are you sure you want to try that?" And he says, yeah, I think I'd like to try that. And so I opened up a bottle and squeezed the dropper and pulled it out, and he opened his mouth, and I squirted it into his mouth. He's going, "Well, that's not too bad." Oh my. And pretty soon he's almost in a panic attack because it's really hot. And so we went and got him some bread, got him calmed down. But when you're having a heart attack, that heat in your mouth isn't no big deal, okay? You want to get over the heart attack, okay? So our next herb is white willow, okay? I like white willow because it is the predecessor to aspirin, okay? So, but the problem is that when God made white willow, he made it so that there are constituents in it that help it to get into the system. So it helps it to assimilate. And then it has the active ingredient, the salicylic acid, and so that will relieve pain and like that. And then it has the constituents for detoxification. So if you take the salicylic acid and you isolate it, what's it missing? What's it missing if you take the main ingredient out all by itself? It's missing the assimilation part that helps it to get into the system. So you have to take more. And that's why there is no toxic dose for white willow, but there is a toxic dose for aspirin, right? The other thing is that and what causes the toxic dose is the detoxification constituents of the white willow that help it to get out of the body after your body's done using it. With aspirin, there isn't any such thing. It's just that main component. So what we will do is we can use this for headaches or minor aches and pains and things like that, and it will help to alleviate some of those pains that you may have. We use it as a pain reliever, but we'll put it in a tea or a decoction. It's actually a bark, so we'll use a decoction. We'll heat it up to a boil, turn it down to a simmer for 20 minutes, and then we'll strain it and put it into a cup. And you could drink this throughout the day without any concern that you might overdose, okay? But pain is one of the big deals in an emergency. You want to get rid of pain, okay? So white willow is a great thing to use for that pain. Yeah. You can do it topically and orally. So there's probably not enough in here, or there might be enough in here for one application for topically. But what you would do is you would rehydrate this, and then you would use it as a poultice. Or you could just simply pour the tea over the top of the wound or something like that. But we typically will use it in a decoction or a tea form so that we're drinking it internally to get rid of that pain that way. Does that make sense? Okay, so the next one, how many of you know about activated charcoal? We've got a question real quick.
If someone's allergic to aspirin, would they also be allergic to white willow?
Some of the constituents, like helping it to detoxify and things like that are taken out of aspirin, are in white willow. Here's what I would do. I was in the Marine Corps, and one of the things that they tell you in the Marine Corps, if you are in a survival situation, that you want to test anything that might go in your mouth. And so if you are looking for plants to eat or something like that in a survival situation, the very first thing you do is you will rub it on your skin. The next thing you do is you will touch it to your lips. And then the third thing you're going to do is you're going to touch it to your tongue. And then the fourth thing you're going to do is take a little bit. So if you were thinking, well, I'm allergic to aspirin, am I allergic to white willow? One of the first things I would do is put it on your skin, see if you have a reaction.
I forget the title of it, but when people have the asthmatic reaction to aspirin.
Anaphylactic or, yeah. So I would, in those kind of situations, I would probably steer away from it, but that's a way of testing it. I certainly wouldn't take a full dose to find out, Yeah, I would test it first, okay? Now, we got another question back here.
What part of the willow are you using, the leaves or the bark?
The bark,
Okay.
yeah. Again, if you're going to wildcraft your own, you want to be responsible because taking a bark off of something is going to kill it. So what we will typically do in collecting white willow bark is we will select a limb and we'll cut that limb off and then we'll use all the bark off that limb. So we're not going to kill the plant. We're going to, we're not going to strip the trunk of that white willow. We're going to choose a limb, cut it off, and then use all of the bark off that limb, okay? So activated charcoal, this is one of our friends. I mean, we like it for poultices. If a person gets a bee sting or something like that, this is absolutely wonderful for drawing bee stings and venom and stuff like that out. I mentioned in my last lecture that my son had a spider bite and it started to move a red line up towards his heart. And his grandparents took him to the hospital. They prescribed antibiotics. What does antibiotics do for a spider bite, for venoms? Nothing. It doesn't do anything. So by the time they got a hold of me, they had already got him home. They hadn't started giving him the antibiotic, but what they did after they talked to me was we put a charcoal poultice on that spider bite. And that spider bite, overnight, went back down to a little pimple look. You could tell where it had been bitten, but it eventually went completely away. And that was just overnight with activated charcoal. We use charcoal for a lot of different reasons. If you eat something that may disagree with you or something like that, like you might get gas or bloating, activated charcoal will absorb that, okay? If a person, and we've dealt with this, we had 7 kids. We had lots of opportunities to deal with vomiting and diarrhea and stuff like that. Activated charcoal, if a kid is vomiting, give them a dose, chances are they'll vomit that up. Then you give them a second dose, and that will take care of it. You won't get that third time of vomiting. Usually within two rounds, they're good, and they can sleep through the night and things like that. So, yes. All those biotoxins, it'll absorb those. And then food poisoning. Have any of you ever gotten food poisoning? One of the worst things that a person can go through. I had a buddy of mine. He calls me up at about 1 o'clock in the morning, and he says, my son ate something this evening, and he is just dry heaving and retching, and he's miserable. He's running a fever. I said, I'll be right over. Brought over my charcoal, and I told the father before we gave him any of it, I said, we're going to give it to him. He's going to throw up. We're going to give it to him again. He'll be fine. And so that's, I mean, just like we were reading out of a textbook, that's exactly what happened. And his fever went down, his pain went down, he stopped vomiting, and it was just on probably 4 tablespoons of activated charcoal, okay? So it'll absorb all the poisons coming off of whatever the person ate. You know, a lot of times it's a meat dish or something like that, or, you know, it's something that's rotten or putrefied or what have you. So activated charcoal will definitely take care of those types of situations. I do a lot of camping. We can use activated charcoal for a filter. You know, I carry coffee filters with me, and we layer it in activated charcoal. You can run bad water through a coffee filter with charcoal in it, and you come out with pure water, okay? The other thing that I like about charcoal is you can use it for a tooth whitener because it has a little bit of abrasiveness, but it also will get rid of a lot of the dinge of whatever we're eating or things like that. So we'll add charcoal to coconut oil, and then we'll add a couple drops of peppermint, and wonderful. Now I tell people, if you make that, it's for you. If you want to make some for somebody else, that's for them, because you're going to dip your toothbrush in there and then brush your teeth. Well, you know, it's just like your toothbrush. You wouldn't give it to somebody else. That tin of tooth powder is for you, okay? And then so, I mean, the amazing thing is even the animal kingdom knows about this. I've watched documentaries where monkeys were eating charcoal out of a fire, you know, and they know what's going on. They know that makes them feel better, okay? So, how many of you have ever had a toothache? Okay, so a toothache is debilitating. I mean, it is off the chart pain. It's right in your head. There's almost nothing you can do about it. But clove oil or clove tincture will numb your entire mouth. Okay, so it will help you to get through a weekend or something like that where you have a toothache, and then once you get you can get to a dentist and have that all corrected and things like that. But in an emergency, you don't want to live through a weekend with an abscessed tooth or a toothache or something like that. It also works for children. It's not, I would probably use the oil as opposed to the tincture for children, but all you have to do is put a little drop on your finger, rub it on their gums, and it will help with that teething that they're going through. The other thing that clove is great for is you can use it for headaches. You know, so you can rub it on your temples or wherever it's aching, and it'll give you temporary relief. You can also use it for anti-parasites. Cloves are definitely anti-parasitic, and so you can use cloves. There's a lady out there, her name's Hilda Clark, and her parasite regime is cloves, wormwood, and black walnut. And all three of these are anti-parasites. And so you can use this to get rid of parasites in your body. And I know we're all Americans, but believe me, we have parasites. You know, a lot of us think, oh, we're American. We don't have parasites.
Okay, we have a question here.
Question?
For the benefit of those who are watching online, please wait for the microphone to ask your questions. Thank you.
Do you know if that parasite cleanse will work the same with cats and dogs? Or if there's a
Yes.
reason not to do that?
Now, I'm a little more aggressive with cats and dogs. They can do all of these because the parasites are not particular what they are, okay? So you can use your cloves, your wormwood, and your black walnut, but I had a little puppy at one time, and it had worms. You could see it when it was going poop and things like that. And so I opened its little mouth, and I had a friend who was chewing tobacco, and I threw just a little pinch in his mouth and held it shut until he swallowed. And the next day, or actually for about the next 3 days, he was pooping parasites all over the place. So tobacco is an anti-parasite. I don't recommend that for my human patients. But you know, if you have a dog or a cat, just a little bit in their mouth, hold it until they swallow. And it's not something that they're going to do over and over. It pretty well will take care of it in about one dose. So yeah, it's a great anti-parasitic agent. Okay. So our next one is iodine. And iodine is a molecule. So it's been around since God created the world, okay? And so, it has been used in medicine for thousands of years. And one of the things that it does is it's an antiseptic. The regular medical people used it forever to wash an area before a surgery or a wound or something like that. And so it will get rid of microbes in those areas. It is great, like I said, with my son. We used it to get rid of that tonsillitis. We use it like that all the time. If we have a wound, you can easily paint it over the top of it, and it'll cause a stain, and then it'll just dissipate. But it will keep those microbes from getting into a wound. It's really good for burns and like that, because you don't want to put a whole lot of things on burns, but this will help. Now,
Can you tell us what that is once again? I'm sorry.
this is iodine. Okay, and it is Lugol's solution, which this Lugol's solution is a 5%, and so we use 100, for a quart of this, we use 100 grams of potassium iodide and 50 grams of molecular iodine, okay? And that makes it a 5% solution, okay? We use this also for thyroid treatments, because most people, their thyroids are not working as well as they should. And the way that I dose this is I take people's temperature. So I want to find out what their baseline temperature is. And, I can't even count how many patients come in, and we take their temperature, and it is 96 degrees or 95 degrees. I had a lady who came in probably about 2 months ago, and the low on our chart is 93, and she was below that, okay? The thyroid is the organ that is designed to keep your metabolism up. And so we started to add iodine to her daily regimen, and her temperature came right up, okay? And so it helps us to regulate the temperature, because it activates the thyroid the way it's supposed to. And the last thing is that iodine has an affinity for radiation. Okay, so if you've been exposed to a radiation, for instance, in 2011, Fukushima melted down, remember? Well, you don't see many health advocate posts on the CDC, which is the Center for Disease Control, but they actually posted that all the people on the West Coast should be taking iodine in one form or another, because it absorbs radiation, and we were getting that from Japan, okay? That nuclear reactor melted down, and they said, don't eat any fish out of the Pacific Ocean, and you should take more iodine. Now, if you're going in for a contrast imaging or something like that, they're going to put some imaging contrast in you. Some of that has some radioactivity to it, so that they can see parts and pieces better. Well, this will help to scavenge that out of your body after the procedure, okay? So I usually tell my patients to start taking this about a week before, and then take it about a month afterwards. And you're going to take anywhere from 2 to 10 drops, just to kind of, and this, again, this is a 5% solution. Lobelia. This doesn't have a lot of functions to it, but it is really good for antispasmatic. So if a person is having a muscle spasm, or they're coughing, or something like that, lobelia will calm you right down. We do IVs in our office, And sometimes if you're doing a high dose vitamin C or something like that, it'll cause a vein to spasm. All we do is just take a cotton ball, pour this out onto the cotton ball, and just rub it on that area. Spasm goes right away. A person might have a back spasm or a muscle spasm, things like that. The lobelia will actually calm those muscles down, okay? And so it's really soothing to have some lobelia on board. For instance, if you are having some respiratory problems, it can stop an asthma attack. It can help you with bronchitis. It'll help you with coughing. So we want to be aware that you know, an antispasmodic is invaluable. All right, so the last one, question.
Torch. You gave me the torch. Question. I have seizures.
Okay,
There's a cyst. I have a little cyst up here.
sure.
And so they gave me an anti-seizure med. I don't like the side effects. So I started backing away from it a little bit. And next thing I knew, I had a seizure.
Right, right.
I was trying to substitute a couple of things, CBD, but it didn't work.
So most seizures are, some of them are because of a traumatic or a space-occupying, a traumatic incident or a space-occupying lesion or something like that. But if it is chemical, a lot of times it's B-complex related. And so we might need to address some of those deficiencies before we could get off of a medication. And you know, seizures are a little tricky because they can come and go, and you might not have them for a couple months, and then you have one, and that makes it more difficult because you're not really aware of what's triggering them or what keeps them away. And so we have a whole protocol, but it's most of it's not lobelia. I mean, lobelia is that spasm is coming from an inside source, and you know it's nerves that are out of control.
Right.
Based on, you know, brain function typically.
Central nervous system.
Yeah. Okay, so, okay.
Would that help restless leg syndrome?
It does. And the way that we use it is both internally and we will rub it on the legs. So internally will help to soothe the nerves from the inside, and then on the legs, it'll actually soak into whatever's closest. It will help restless leg. But again, kind of like the seizures, restless leg isn't caused from a lobelia deficiency. You see what I'm saying? Lobelia is an antispasmodic, and it will help the spasm, but we really want to get to the point, to the cause of restless leg, and many times that's a toxicity. So we want to clean the liver or the elimination organs, and once we clean those out, we have a pretty good result in getting rid of restless leg. Now, we also got to, it may be due to deficiencies like to magnesium or calcium and things like that that regulate those nerves. You might not have enough potassium because in order to fire a nerve, you have the sodium-potassium pump that causes the nerve to fire. If you don't have enough potassium, they're going to either stay firing or they're not going to fire at all. And so you want to be aware that there may be toxicity and deficiency that may be playing there. This would be a topic, I mean, that would be a topical that you could put on or take in, and it would cause antispasmodic. So you'd stop spasming, be a temporary relief, but it would be something in an acute situation that you could take and get some relief, as opposed to you're not curing it. This is just to stop that momentary spasm, okay? So the next thing on the list is colloidal silver, okay? And there are benefits and warnings that go along with it. And so we do not use colloidal silver prophylactically. We don't take it all the time. We only use colloidal silver in an issue where we have a microbe or something like that, a infection, because it's great for those issues. Where people run into problems is, number one, they'll probably make it themselves, which is fine, but then they'll consume too much, and they'll do it on a daily basis. How many of you ever seen The Blue Man? I mean, you know, this is what the AMA will use to warn people not to take colloidal silver. But that guy is missing an enzyme that detoxifies colloidal silver, and so it turns his skin blue, okay? That's not the rest of us. I still don't recommend large doses of it. I recommend that you use it in a situation where you might have a cut that you want to wash it with, or we use it for, you know, a person who might have a sore throat and they want to gargle, and they'll get rid of that bacteria or what have you in the back of the throat. We even use it many times if a person is having a lung infection. We'll use it in a breathing machine. We use about 3 milliliters of this in a nebulizer, and then we're going to breathe it in, and it won't cause any harmful effects, but it'll get rid of those bacteria that are in the lungs. Another place that we use it a lot is in a neti pot. A person has a sinus infection and things like that. They want to wash out their nasal cavity and like that. You put about 50% colloidal silver to 50% normal saline or salt water, and then you just flush that area out, and the colloidal silver will kill all the bacteria that's up there. And so it's very beneficial. It's real easy for kids to take because it doesn't taste. It doesn't have any taste at all. And so, you know, you can get kids to take a teaspoon of this and, you know, you say gargle or whatever, and there's no taste, but it has an antibacterial effect to it, okay? And so these are some of the ones that I like to carry around with me. Believe me, this is not a full medicine cabinet. So, you know, some of the things that we can add to that would be clay, because it absorbs. You know, if you have a bee sting or something like that, it'll absorb. Plantain. Plantain grows in a lot of different places. You can just pick it for almost any place. Great for bruises or cuts or things like that. Comfrey, again, abrasions. It heals those bruised area. Red clover is number one, it's a great tea. Number two, it is good for blood thinning or purifying an area. Hawthorn is great for heart conditions. Iodine for antimicrobial. Slippery elm, if you have a sore throat or you have a stomach upset or some bad feelings in your intestinal tract. White willow for stopping bleeding, especially in areas that are sensitive. We stop bleeding easily with cayenne pepper, but what if you're bleeding from a sensitive area? You know, you don't want to put cayenne pepper in some places that, because they're sensitive, you know, that might not be your best experience. White oak bark is fantastic. We had a lady who had ulcerative colitis, and she was bleeding 1/4 of a cup of blood a day from her intestines. And we prepared a white oak bark enema. In just a few days, she stopped bleeding completely. Okay, and so it's what we use for sensitive areas for, you know, for bleeding. Peppermint, you know, world renowned for calming stomachs down and things like that. Same thing with ginger. Had a guy come to our office who was bedridden, and we were helping him with some bed sores and like that. But he was on heavy drugs to keep him from having acid reflux and upset stomach. And I made him a ginger tea, and he says, this works better than any of my medication. And so we absolutely love ginger. Honey, for kids that are over 2 years old or so, you can use that for coating their throat for cough suppressant and like that. Lemon, it'll cut the phlegm, it'll aid the digestion. Most of us that are over 40 years old, I know that there's only a few in this room, but we start making less and less acid in our stomach. And so, you know, many times lemon is a digestive aid, because if we don't have acid in our stomach, number one, it doesn't provide us with protection. That's what the acid's for. It's for provide us to keep microbes and things like that from getting into the rest of the system. The other thing is that high acid will activate pepsin. It'll take pepsinogen and turn it into pepsin, and that's the start of protein digestion. If you have low stomach acid, you're not digesting your proteins. And many times proteins getting into the small intestine and getting into your bloodstream in a too big a form is where we get allergies. So lemon is great to add to a meal. Okay, so then we have tea tree. How many of you ever used tea tree? Great antiseptic. Garlic is one of our favorites. If a person has an infection like that, we often recommend that they eat a bulb of garlic a day. You know, when our family would go to church, I had this one guy and he said, "Man, you can always tell when the Meads are here. It smells like an Italian kitchen." But, you know, garlic is anti-parasitic. I actually have a garlic preparation that comes from overseas, and 1 teaspoon is equivalent to 50 bulbs of garlic. We get rid of MRSA and medically resistant Pseudomonas and like that all the time with that garlic preparation. We love garlic, okay? So there's lots of herbs out there. You know, God made these herbs for us, you know? And he said that the leaves of the trees are for the healing of the nation. But if you want it in a bottle, you got to pay for it. So it would behoove you to learn these things, okay? But if in an emergency, it's good to have some on hand. I think I only have a few minutes left. Does anybody have any questions? It doesn't have to pertain to this. I have a question up here. Here, give it right here.
When does lemon juice become alkaline in your system? I mean, it's acid.
Right. Oh, here you go. Okay. The question was, when does lemon juice become alkaline? And so the miracle of lemon juice is that it is an acid. You know, when you pH test a lemon, it's an acid. It's down there around 3 or 4. As soon as you put it into your mouth and it gets to your stomach, the acid is used, and then the other constituents of the lemon become alkaline. So after it leaves the stomach, it is alkaline.
So you're saying that what aids digestion?
It does.
Stomach,
Yes.
then it becomes alkaline.
It becomes alkaline and alkalines your body. Over here, we got another one over here.
What does one of those kits cost that you keep in your car all the time?
So with this here,
Right.
with all the things that are in the kit, it's $50. And we commonly will sell this for about $48 in our office. But, you know, we put these together, bought things in bulk. The unfortunate part is these kits, most of these are supposed to be 1-ounce bottles. At the last minute, they sent us 2-ounce bottles. So we only filled them half full. So if you buy a kit, it'll be half full. It'll be sealed, tamper-proof sealed. But I do have them today. Yeah. And, you know, we're selling this here. If you don't want a kit, this is $10. But that way you can go buy your own herbs or wildcraft your own herbs or things like that. Because I like people to know what they're doing and have something that they can reference. Like I was telling the last people in the last class, this bottle here will cost you $40 in our clinic. This will cost you about $45 in our clinic. This is 4 ounces. This will make a quart. So if you add your own to this, you get a quart for about the same price that you're buying something for 4 ounces. So we encourage people to spend less so that they can have things on their own shelf. So we want to make sure that you are covered. But this kit is about $50. Okay? Back here. Yep.
We have willow trees on our property, but you said white willow. Is that this?
So the easiest way to determine whether it's a white willow or not is to simply turn the leaf over. If the leaf is lighter on the back than it is on the front, that's white willow.
Okay.
Yeah, and you can use that. Are we out of time? We're out of time, okay? I will be here, so